Thank you for choosing Orthopaedic Medical Group of Tampa Bay for your upcoming joint replacement surgery. Your surgery is right around the corner, so we'd like to review a few important things to help your day go smoothly. First, please make sure to answer any calls from our offices. Our surgical center will call you one business day before your surgical date, usually after 1 p.m., to give you your exact arrival time. While we make every effort to accommodate patients, the time of your surgery is based upon many factors. We appreciate your understanding and patience with knowing that each surgical day moves at the speed of safety. It's very important that you arrive at the time we provide you. Please make sure you arrive on time and bring your valid photo ID. Next, please make sure you have obtained your shoulder sling and you are prepared to bring it with you to the surgical facility. If you have not yet obtained your sling, please contact your surgical coordinator immediately. If you have not yet purchased other essential items like an ice machine or TENS unit, you may do so on the day of your surgery. Please notify a team member if you wish to purchase these items. You must also have a responsible adult available to drive you to the surgical center and take you home after surgery. For safety reasons, you will not be allowed to leave the facility alone or in a ride-share service.
Next, let's review medications that may need to be stopped before surgery. If your surgery is being performed at a hospital facility such as South Florida Baptist Hospital or St. Anthony's Hospital, the hospital team will contact you separately to review specific medication instructions. For patients having surgery at Orthopaedic Medical Group Surgery Center, please review and closely follow these guidelines listed on your screen now. If you have any questions or concerns, please reach out to your surgical facility. There are some medications you may not be allowed to take on the day of surgery. If you have diabetes, there are also special instructions you will need to follow. Please take note of these protocols listed on your screen now. Our goal is to keep you safe throughout your surgery. It is important that you understand which medications you should take and which ones you should stop before surgery. Failure to follow these instructions could cause your surgery to be canceled. If you have any questions about your medications, please contact your surgical facility. Finally, please remember that you may not eat any food after midnight the night before surgery. You may have clear liquids only up to 2 hours before your surgery time.
If you have any questions before surgery, please contact your surgical coordinator. We look forward to taking great care of you and helping you start your recovery.